Hello, I'm Dr. Dominique Dempah. I'm a general surgeon with LewisGale Physicians. My emphasis is foregut surgery, which means the upper part of the abdomen, which includes the liver, the pancreas, and the esophagus. Gastroesophageal reflux or heartburn is one of the most common complaints that we see, that physicians in general see, and that many patients suffer from. The majority of the patient will be able to take care of those problems with just using medications, but there are a certain number of patients that unfortunately are not able to be taken care of just by medications. And those patients are ideal candidates for some of the surgical procedures that we offer, again in a minimally invasive way, to take care of that reflux disease. The most common operation that's performed to take care of it is the Nissen fundoplication, which I perform laparoscopically and robotically. Many times, a patient with severe reflux and severe heartburn that are not able to take care of it with the medication, it is because the heartburn is associated with the hiatal hernia, which is that condition where part of your stomach slides up in your chest, and therefore, as the stomach makes acid, if it slides up in the chest, it's directly up. That the acid is coming back really quickly up in your esophagus, which is that tube that between your mouth and your stomach. And when that's the case, again, the medication just won't be enough. And those are situations where a patient will benefit from a laparoscopically or a robotic Nissen fundoplication and hiatal hernia repair. Generally, a hiatal hernia is performed in a minimally invasive way, which for me would be laparoscopic or robotic. On those that are not as extensive, the hospital stay could be as short as 2 days. For patients that just have the severe reflux, where they take the antacid medication for a long time and it's still not working, and again, if after testing we feel like that reflux that could be amenable to a surgical repair, and that's something that we can do laparoscopically or robotic, and with a very short hospital stay, within 24 to 48 hours, which is a complete different recovery than if you were to do those procedures in an open manner. The recovery time for a minimally invasive fundoplication or hiatal hernia is typically within 48 hours. It all depends on the severity, for example, of the hiatal hernia. Somebody that has a very large hiatal hernia, some people have more than 50%, more than half of the stomach in the chest, and those may require a little more extensive work within the chest to take care of that. They may stay in the hospital 48 to 72 hours. Some patients have a smaller hiatal hernia, and they may be ready to go home essentially 24 hours after the procedure. And the use of a minimally invasive technique allow them to be able to move around and to be able to drink and eat after the procedure.